Good afternoon, ladies and gentlemen, esteemed colleagues, collaborators and CHRODIS Plus partners. On behalf of the Irish CHRODIS Plus partners, the Health Service Executive and the Institute of Public Health, I want to extend Cate Hartigan and 100,000 welcomes to all our guests here from overseas and from around the country for this joint action CHRODIS Plus site visit. I would also like to welcome our Minister of State for Health Promotion and the National Drug Strategy, Byrne, who will address us shortly. You're very welcome, Minister, and thank you for your time this afternoon. As I said, people have come from across Europe to be with us today, from Lithuania, Iceland, Italy, Spain, and closer to home, as I said, from Donegal has to have a mention because I'll be told off if we don't say it. One of the things in always Donegal, and the sun was shining there today. We arranged this clearly for our visitors that Dublin looks gorgeous in the sunshine, so I hope you get some opportunity to enjoy it. One of the key themes, I think, going over the 2 days that struck me in reading my speech was about collaboration. And this is the essence of this project in itself, and it's the essence of CHRODIS and CHRODIS Plus. How we collaborate both internally within our own organisations and externally across other organisations and agencies. And I know that some of my colleagues will be referring to that piece as it threads through the 2 days. So I'm very pleased to be invited to chair the afternoon session. It will be informative and engaging, at least the speakers had better be, or we'll be complained about them. But it sets out the background of the policy context for after school flags, as well as hearing a comprehensive overview of the programme itself. We're all aware that chronic disease prevention poses one of the greatest health challenges both within the European Union and in Ireland. Chronic disease costs EU's countries 115 billion, or 0.8% of GDP annually. I mean, it's phenomenal, isn't it, that what you could do with that kind of money if we were able to solve some of the chronic disease issues. Most of these can be prevented or delayed by reducing or avoiding key risk factors such as smoking, poor diets, obesity, physical inactivity and alcohol consumption. While the health status of Irish people has improved more rapidly than in many other EU countries, there's still room for improvement. Smoking rates and alcohol consumption continue to decline, but binge drinking amongst adults remains a problem. Obesity rates among adults and adolescents continue to present a major health challenge for us. In addition, these behavioural risk factors are more common among disadvantaged populations. So they have a double whammy there in terms of their health and their well-being throughout their life course. So people living in the most deprived areas of Ireland are more than twice as likely to smoke than those living in the least deprived areas. And the situation is similar for binge drinking and obesity. Within the health service, a key focus for us is chronic disease prevention, and our focus in health promotion and improvement has been on embedding preventative health measures and messages into health services to improve individual, community and population health, targeting modified risk factors such as the smoking, alcohol consumption, the physical activity and the obesity. So those are phrases or words or descriptions that we will come again time and time to, particularly in relation to the physical inactivity and in this case the very positive physical activity for our young people. So my team therefore in health promotion, they act as enablers, negotiators and advocates to build and leverage capacity within the health service and with external stakeholders. Again, that collaborative piece, it's something that we can't do on our own, and health isn't an issue just for the health services, all of you will be aware. The social determinants of health are far more wide-reaching than that. And so we work with external partners as well in order to deliver on. We have a Healthy Ireland framework, our health policy, and the Minister will talk more about that in a few moments. In addition, we have a strong focus on education, encouraging children to adopt healthy lifestyle behaviours. And my colleague Orla McGowan will be speaking to you later in relation to how the HSE takes that collaborative approach, working with the Department of Health and the Department of Education and Skills to promote health and wellbeing in schools across the country. Ms Fiona Mansor from the Department of Health will present on Ireland's National Physical Activity Plan in order to provide policy context for increasing physical activity across the Irish population. Excuse me. From a practice and implementation perspective, Ms Karen Cotter, Active School Flag Coordinator, will provide a detailed and comprehensive overview of how the Active School Flag works in practice This will be of great interest to our Italian and Lithuanian colleagues in particular, who intend to transfer and implement the active school flag in their respective countries later this year and throughout 2019. We know that there is a wealth of knowledge within EU member states on effective and inefficient, fraudulent slip, efficient ways to prevent and manage chronic diseases. There is great potential to reduce the burden of chronic disease by making better use of this knowledge, and that's the reason we're here, in terms of a really good, wonderful programme that we have in this country that has key partners within it. Health plays a small part within that, but the gain for our young people is really enormous, and I know that that will be discussed later. So CHRODIS Plus is the platform for sharing and exchanging models and policies on chronic diseases. Through our involvement in this joint action, we know the good practices in health promotion for chronic disease prevention exist. We know what works, and we need to share that information. So it's our collective knowledge, experience, wisdom and expertise that will help us address those chronic disease issues, and that's the ultimate goal of CHRODIS Plus. The value of European collaboration exchange must be acknowledged. It's important in providing networking opportunities to share ideas and develop new ones that may lead to opportunities of improving how we do our business in promoting the health of our respective populations. My colleague Dr. Teresa Bennett will be speaking to you later into the very successful Irish CHRODIS collaboration between the HSE and the Institute of Public Health in the European Joint Action CHRODIS. I think we need another acronym, because every time I try and say that European Joint Action CHRODIS Plus, it's quite a mouthful. So later on, the CHRODIS Plus partners from Italy, Spain and Iceland will present on the planning requirements in the next implementation phase of Active School Flag initiative to Italy and Lithuania. So before I introduce the Minister, I just want to mention a few housekeeping points. So the exit is where you came in. If there's a fire alarm, we will all leave orderly and quietly onto the main street. The bathrooms are out the door and to your left. I will just warn the speakers, we're tight on time and we were slightly late starting, so I will be waving at them when they get to their minute up, and if they go over the minute, I'll stand up so they can't miss me. That doesn't go for the Minister, of course. Ministers can do what they like. The session is being recorded and will be made available, publicly available. There's copies of all the presentations in your packs. We're going to have a stretch break at around 3:15. It'll be a bit later than that now. So we all know about sitting too long and the detriment that is to our health. It's the new smoking, isn't it? We need to mind ourselves. And we'll try and keep to time, as I said. There's a lot of people who've been involved in bringing today to fruition, so I do need to mention a couple of them. So from the Institute of Public Health, we have Helen, David and Tara. They've been working diligently in making this an event today, and particularly from the HSE for Teresa for the work that she's put in on behalf of us. So I want to thank you all for your efforts. I know from working with you that it'll be a worthwhile afternoon, and on that note I really would like to introduce the Minister. So if you welcome the Minister.
Thank you. Well, the Minister always knows when to stop, to be honest with you. So, but you can wave away, I don't mind. No. Well, good afternoon to you all, ladies and gentlemen. I'm delighted to be here at the launch of this event, which over the next 2 days gives you a real opportunity to share your experiences and promote health for all our school children. I want to begin by extending a special welcome to all our visitors. I'm not going to name the countries again, you've already named them, but I want to welcome them to our capital city on this beautiful day. It's rare, but we have a nice sunny day today, but we do have a lovely capital city, and I have to say with extraordinary happy people, especially when the sun comes out. It's great to see such a high level of interest in what we are doing here in Ireland to improve our children's health, and I hope your visit of benefit to you in implementing or having some similar initiatives in your own country. The CHRODIS Plus action is a great example of European membership states working together to address our common problems, and I want to acknowledge the funding provided by the European Commission for this action. I think it's very important when we come together at an event like this, we acknowledge that across the European Union that we have a real working cooperation in place, and I think it's very important that we have a chance to meet each other, and above all to share our work that we're doing together. There's a wealth of knowledge within the EU, effective and in effects many ways to prevent and manage chronic diseases. and there's a great potential to reduce the burden of chronic diseases by making better use of our knowledge that we all have. This mirrors our experiences here in Ireland, where we have recognised a partnership approach between different sectors of our society is necessary in order to address the challenges we face in promoting a healthy Ireland. In recent years, we had to examine how we as a society can address the problems such as rising levels of chronic illness, lifestyle trends, and threatened health and persistent health inequalities. Considerable progress has been made to address the lifestyle risks and ensure better detections, treatments, and control of diseases and threats to public health. The death rate has gone down and people are living longer. However, those improvements are at risk given the rise of level of obesity, diabetes, and inactivity. And I suppose that's what the school activation plan, Active Flag, is all about, the inactivity in young people today. And I'll speak a little bit about my own experience of that in a while. I suppose our response to these challenges set out in our national policy on health and wellbeing, Healthy Ireland, a framework for improving health and wellbeing for 2013 to 2025. Healthy Ireland is a priority for this government, and the object is to create an Ireland where everyone can improve or enjoy their physical and mental health and well-being to their full potential, where well-being is valued and supported at every level of our society, and everyone is responsible for that. Healthy Ireland sets out a number of action areas and themes with a focus on doing things better to achieve 4 key goals: the increased proportion of people who are healthier at all stages of their life, reduce health inequalities, protect the public from threats to health and well-being, and to create an environment where every individual and sector of society can play their part in achieving a healthy Ireland. And I suppose that's what the Active Flag is about. It's about creating a space within our schools, trickling down into our homes, and then trickling into our communities. And when recycling started in schools, we hadn't got the green bin and the brown bin and the black bin. And I was always struck by the fact when my children came home from school, they actually started recycling all the different cardboards and papers before it actually came into action in our homes. I think it's very important, as somebody who has 5 grown-up children now and a number of grandchildren, it's very important that we participate in their learning in school and what they're doing and the activities that they're doing, because they really do. Children have a great way of making mummies and daddies and everybody else sitting up and paying attention, and I think that's very important. Kate spoke about the inequalities in our society, and I suppose I could stand up here and talk for the next half hour about inequalities, and she's really correct when she says about it's in poorer communities, and that's where we have most obesity in young children now under the age of 5. And I really do think, as a minister in government, and particularly with health promotion, we have to, step up our efforts in every way we can to make sure that people living in less poorer areas have every opportunity through education, through their health, and above all through their well-being, to be able to have a healthy life into the future. We had in the Dáil a number of weeks Dorina Allen. Probably the people from other parts of Europe might know, but Dorina Allen is a very famous cook in this country, and she came in to visit us, and we had a great conversation that afternoon about school meals and what should be happening in schools. And I was struck by one thing, her real common sense. The common sense of what we would call in the past, there was nothing like your mammy's cabbage and potatoes. Do you remember that? Probably do. But anyway, and I suppose in the afternoon when we were speaking to her, was one thing that came clear was that she never forgot how important it was to be able to cook yourself and share that with your children. And I think that's what I got out of the afternoon, being with your children and showing your children how to cook and prepare meals, and how that leads them to a healthier lifestyle as well. So we want to continue on that journey with her over the next couple of months through Healthy Ireland, to promotion of food in schools as well. But to get back to why we're here today, since the publication of Healthy Ireland in 2013, a wide range of policies, initiatives have been published seeking to address the challenges of our health and our well-being. One of these is our first National Physical Activity Plan, by which we are aimed to increase activity levels across the nation. High activity levels are particularly important for children, not only for their physical health, but also for team building and to improve their competence, and above all to improve their mental health. And we live in an era where the computer and the the phone have become very much part of everybody's lives, to down as young as 7-year-olds actually getting iPhones for their communion. And I really think that has changed the mentality of where children see themselves as being part of playing, not with their friends, but being very isolated into themselves and playing on computer games. And I think we need to start, I suppose, changing the attitude of parents and of children to around how important there is to become part of a team and to build on that team. And the only way that can be done in many ways is by being involved in school, being involved in the grammar activities, and most of all, being involved with your children as well. So to pull them away from the television, and I suppose pull them away from their laptops and their iPhones can be very difficult, but I think there's real benefit for everybody if that can happen. For us all here in this country, education has been one of the most important factors in implementing our Healthy Ireland, and there is a close collaboration between the Department of Health, Department of Education and the agencies of both departments. This work together is essential in order to coordinate the responsibility in relation to the school curriculum and to wider health promotion issues in school settings. One example that the Department of Health is working with is to support the new Junior Cycle of Wellbeing programme, which was introduced in secondary schools in September 2017 for incoming first years. And it's great to have, I suppose, new initiatives coming into schools, but what we need in schools as well is the principal and the teachers in the schools become very much part of that. And I suppose we've been very lucky in many ways in this country through many of the DESH programmes in poorer areas and in poorer schools, where there has been huge activity in the classroom with promoting health and well-being, and above all dealing with children coming from very sometimes uncomfortable, disturbing backgrounds in their own home, and when they come into school to be able to participate with them in activities. I think it's very important. We're committing to the provision of 300 hours across 3 years, raising it to 400 hours in due course, and including the increase in time as we go along located to physical education. If there's one fault we have in this country, and I'll be very critical about it, is this: some of our schools, particularly our older schools in the inner city, don't have what we would call in modern schools today, modern new schools have been built, proper gymnasiums and proper halls. And I think we really have to take that on seriously. If we're talking about getting children healthier, there's no point in asking the teachers in the class to take 30 minutes out to run around the yard with children. That's fine, but we need to build on building proper facilities, and above all adding to schools where they don't have those facilities indoor, because for all of you who come from other countries where there's sunshine probably for 3/4 of the year, in Ireland it's the opposite. We have 3/4 of the year with rain, so it's very important we have an area that people, particularly children, can come and, how would I say, go home and dry clothes after they've done their physical activity. So it's very important that we work on that. I suppose the department is in partnership with supporting the Department of Education and Skills regarding the development of new curriculum for senior cycle and even cert PE. Certificates for PE, and it's the first time we will be having senior cycle leaving cert certificates for PE in this country, so I think that's very important as well. And it's against the backdrop that many departments have been happy to support initiatives such as the Active School Flag. As you will be aware, the flag is currently awarded to primary schools that strive to achieve physical education and physical activity schools communities. A small but increasing number of secondary schools are also becoming involved, and a specific programme for secondary schools is being developed into the future. And I suppose when you start off a programme and you start off in the junior cycle and you work yourself up, you work your way up through it, it's very important that the children in the secondary school get the opportunity as well to become part of that curriculum, because I really think it's important. So I really want to support the new curriculum of health and well-being, because it just doesn't talk about activities, it talks about the well-being of yourself, your mind and your health and your body and everything else. So I think it's very important. The Active School Flag progress aims to get more schools active and more often. Schools wishing to receive the flag must undertake a rigorous process of self-evaluation of their current provision in the area of physical education, physical activity and partnership. Schools must also organise an active school week programme and commit to having it as part of their annual school calendar. And it's great when you see these programmes starting up, but somewhere along the line things start to fall down. So it's very important that we have people who are actively feeding in to schools and kind of, I suppose, keeping the standards up as well. So I really think that's important as well. In April there, we launched a new initiative, the Active School Walkway, and it was developed to get Ireland walking again, but it actually started off in the schools as well, and was launched by the Taoiseach and myself and Minister Harris. And there's an actual, how would I say, in the schoolyard there's a pathway mapped out, and children can take activities on the pathway during the day. And I just thought it's a real cool way of getting children to know about different things when they're out walking and what they should be doing as well. I was in, I think it was Finland, yeah, it was Finland, there a while back, and we actually visited this playground, play area, which had for biking, for children on bikes, and teaching children the rules of the road, and a small little area set aside in a park. And I thought it was a wonderful idea to see children about 3 years of age on their pedal bikes and not on their pedal bikes as well, and trying to just bring them through the process of learning how important activity is, but being safe as well when you're out playing. And I really think it's a good initiative. I suppose the whole thing about it then is only when a school has satisfied all the successful criteria that they're awarded the flag, which remains valid for a period of 3 years. After this, they must reapply. And I think that's important as well, because what that does is it makes the school keep on the right path and keep trying to improve the activities that's happening within the school. And it's good that people then can reapply, and if they've fallen down in places, that they can be kind of, I suppose, I won't say brought to task, I've said it, but I shouldn't have said it, but to be assured them that, you know, if you've done something wrong, that it can be fixed as you go along. As far as the ASA programme is a key initiative in building healthy behaviour in schools by increasing levels of physical activity and therefore reducing the obesity levels. Furthermore, there is a substantial body of evidence and documentation that improved levels of focus on discipline among children in school results from increasing activity levels during the school days, which lead to better academic outcomes. Now, I've known this for a long time actually. I've known it all my life. The more active your children are, the more opportunities they have of being, I suppose, confident, looking after their well-being, but most of all, being mentally well as well. And I think it's very important that children get that opportunity as well. So I think it's one of the real outcomes demonstrating, and the statistics are there, that this really happens to children and in schools when they're in an active school as well, an active school plan. We are delighted that through the EU Joint Action on Chronic Diseases, other EU regions have the opportunity to learn about the active school flag and to implement a similar programme in parts of Europe. It only now, I suppose, leaves me to wish you every success in the next 2 days in what you achieve. Above all, to listen to each other and to learn from each other. We have an awful lot to give in Ireland, but we have an awful lot to learn as well from other countries as well. And I want to thank you for the opportunity to just say a few words. I suppose all of our role, whether you're a politician, whether you're a parent, whether you're a grandparent, whether you're part of an organisation or an agency, whether it's in this country or in one of the other countries, the importance of health and well-being of our children is vital if our children and our children's children is to succeed in life. And I suppose if one thing wish I could have is that all schools in this country, all schools, whether they're in the inner city or they're down in Mayo or in Donegal, that they have the opportunity to have proper facilities within the schools. And I think we've done really well in the last couple of years, developing those schools and putting in the facilities that's needed. But we still, I suppose, lag behind in many ways in other countries where, I suppose, when schools were being built at the time, proper PE rooms were being built as well as part of the school curriculum. So I think we have a long journey to take on that one. But I'm really happy to be here this afternoon with you to say a few words. I hope over the next 2 days that you really have time to speak to each other and listen to the presentations as well. I will be flying, I don't mean flying, I mean flying out of the room in about an hour's time to go somewhere else. So every success to you all. Have a wonderful, will I call it a conference? No, it's not a conference, it's a conference. And enjoy each other's company, but most of all, enjoy the beautiful weather and good health. And thank you very much.